This is a great victory day for health care in our state and our country. And I think it's very, very important that we gather at a special place for health care in our state. Lurie Children's is a great, great hospital. It focuses on our children. It is a new structure, as we all know. Our state is so proud of all those who work here, all of those who come through these doors, and we're very grateful for the opportunity to be here to sign these three bills today that were all passed unanimously by the Illinois General Assembly. And I think that is meaningful, that both houses of the General Assembly, both parties, every single member voted for each and every one of these three bills. And they all deal with health care for babies and making sure that breastfeeding is given the information and option to all new moms when they have a baby. Then we also believe in the opportunity for CPR and using AEDs and making sure that all of our citizens, even those in middle school, young people, know how to use CPR and AEDs in order to save lives. If you save one life, you save the whole world. That's a passage from the Talmud, and we take it to heart in Illinois, that it is important that all of us as a society understand the importance of saving lives and preserving lives. And then finally, we have an opportunity for our businesses to work together in cooperation to purchase health insurance for their employees. This had the great support of our business community in Illinois, with great leadership from members of the General Assembly, led by Senator Kwame Raoul. And I think this is another way that we can have better health care in our state of Illinois. And I think we all know that today the United States Supreme Court spoke. That is the court of last resort. It spoke on behalf of the Affordable Care Act and affirmed that law, a very important law for our state and for our country.
This bill, Governor, is something that is important to us who work in the emergency department and their staff from the emergency room at Northwestern, at Children's, and this is going to resonate across the state. Because what we know is that first initial piece, when someone suffers a cardiac arrest, is the one piece that we don't have control over. And in those first 4 to 5 minutes, the bystander who steps in and offers that support and starts CPR and or uses an AED makes a difference in that life. And we hope that the lives that passed before us are watching down and realizing that we're doing something about it. And that's why we're excited about this bill, and there's more to come.
As the son of a community physician who passed away exactly a year to the date before I was appointed to the Senate, I feel that, notwithstanding my not following his footsteps in medicine, I owe something to him in terms of the public policy that I work on as a legislator. And that's why two of these pieces of legislation that I was proud to be the sponsor of. First off, we're in this wonderful building that I was happy to be here at the ribbon cutting a few weeks ago, and then a little nervous about being here about a week ago with my daughter in the emergency room. Fortunately, she's fine. But one of the things that my wife and I embrace early on is the notion of breastfeeding leading to better outcomes. And my wife had it down to a science. And I have two healthy children. And what it speaks to is preventative care, generally. And when we talk about preventative care, access to health care insurance is an important element of that. Because those who don't have access to health insurance utilize the emergency room as their physician in lieu of having access to a coordinated care that allows them to prevent worse outcomes in the future. So working together with the Chicago Chamber of Commerce and others, we realize that many working people don't have access to health insurance because they're employed, most people are employed by small business owners. And another bill that the governor is signing today will allow these small business owners to pool together for purchasing power for health insurance. This combined with when we get the health exchange going and today's decision will allow for what my father believed when he never turned down a patient because of their inability to pay, will allow for all of the citizens in the state of Illinois to have access to health care in a manner where they can embrace preventative, coordinated care. Thank you.
On this auspicious day when the Supreme Court reaffirmed the right of everyone to access health care in our country, I have been an advocate for 12 years of some sort of a pooling to help the citizens of our state. And I felt like Don Quixote. For the first 8 years, I would pass it over to the Senate and it would just die. And then as the focus went on Washington, I stepped back. And 2 years ago, I was encouraged by the Small Business Advocacy Council to again pick up the baton and to work for this because it is so important for the small businesses and the employees of small businesses in our state. I ran my own business before I was a legislator for a couple decades, and as I rang thousands of doorbells, people told me that not being able to access an affordable insurance product was really, really holding them back. Mike McRaith, the former director of our Department of Insurance, said, forget the pooling, we're going to go with co-ops. We've got a great bill. Again, passed it out almost unanimously in the House last year. It was House Bill 3236. Jeff Schoenberg worked on it that year. This year also, the Chicagoland Chamber of Commerce, I have to acknowledge them. Without the business groups pushing for it, I don't think we would have worked it out, because although the governor said it was unanimous in the end product, it was the advocacy groups, it was Senator Kwame Raoul and everyone pulling together and smoothing it out. What we found out as our country was focused on the Affordable Care Act, that really with a couple tweaks, we didn't need to do it as comprehensively. With a couple tweaks, we could help our businesses, and that's what actually happened with the final bill. So it is a good day for businesses, for citizens, all the way up from our president's office down to the governor signing these bills, and the groups, the advocates who backed up Senator Kwame Raoul and me as we pounded out the final details on this bill. Thank you.